So good morning again. It's great to see all of you here. As Katie mentioned, the DMC Foundation started about 2010 when the Detroit Medical Center, therefore the name DMC, was sold and became a for-profit hospital, and therefore all the assets were no longer eligible to be used by the DMC hospital system directly. As you said, it's a supporting organization of the Community Foundation, and think of it really as an independent affiliate of the Community Foundation, separate board that makes the grant-making decisions. The back office work, all the important back office work in terms of grant making and investing the funds and the grant processes is all done by the Community Foundation staff, and therefore provides great economies in terms of making sure that the dollars that are available can really be focused on grant making. As I said, it has a separate board. And in 2014 is when the DMC Foundation, now at the Community Foundation, started making its grant making in earnest. And our first year, we did about $1.75 million in grants. So the question then is, what do we fund? This is more narrowly focused than the Community Foundation is in health and health-related areas. The primary focus, as it says here, is health-related education and community benefit activities. And we're interested in direct medical services and population health issues and the grants that are coming, applications that are coming to us. Just as Katie did, I'm going to give you a few examples of the grants that we've done in 2014. Again, our time is a little narrow here, so this is not going to represent the breadth of work that we plan on doing over the years, but we'll give you a picture, I hope, of the kinds of things that we're looking at as we go forward. So one grant, Make Your Date. And this is a program with the Wayne State University School of Medicine and the NIH Parentology Research Center, which is housed at the Harper and Hutzel Hospital. I'll underline this a couple times. It's really important that we're not limited to funding programs at the DMC hospital, but when there's opportunities that are coming out of the DMC hospital system, even though it's a for-profit, that fulfill the charitable purpose of reaching certain target populations, then we work with them in order to make sure that we can do programs that are meeting that purpose. And this would be an example of that, the Make Your Date program, and as I said, with the School of Medicine and the Parentology Center. So the purpose of this program is to reduce the preterm births in the city of Detroit, to get women and their infants to 38 weeks. Therefore, Make Your Date. Why? Well, the infant mortality rate in the United States is about 6.15 deaths per thousand. In Michigan, it's 7.1. And in Detroit, it's 14. One of the highest of all the major cities in the United States, and I think, as many of you know, higher than in some countries in the world. So the program is designed to provide comprehensive education and innovations, working with hospitals, again, not just with the Harper and Hutzel Hospital, but hospitals throughout the city in order to lower this tragic infant mortality rate. Obviously, the great purpose here is how we can get more healthy children to birth. We also do work in training and education for frontline medical providers. This is a program that we did with the Detroit Fire Department, and it was training that was provided through Detroit Receiving Hospital. So it provides basic life support and cardiopulmonary resuscitation classes for Detroit firefighters. In the last year, they've done about 200 firefighters. So again, the question is why? Well, there's a couple of reasons. In the city of Detroit, the EMS system and the Detroit Fire Department system are independent from each other. And so as a result, the fire department many times, most times, is showing up at fires before EMS gets there. And that's a critical moment when fire victims may be needing CPR or a basic life support treatment. And so with the firefighters having this training, they're able to do that emergency care right at the beginning. While we don't have data yet in terms of what has happened as a result of this, we do have a number of anecdotes already that have come back to us where the firefighters with this training have been able to save both adults and children when they've got to the fire. We're also interested in innovative programs. This one sounds pretty straightforward, oral health care for pregnant women. This is a project with the University of Detroit Dental School, Wayne State University, OBGYN program, and the University Health Center Clinic. So the purpose of this program is to train both fourth-year dental students and OBGYN residents on oral health needs of pregnant women. Oral infection can cause any number of problems, both for the woman and for the fetus, and which therefore can cause birth problems. Dentists often are cautious about dental treatment for pregnant women because they don't fully understand what the repercussions might be of prescribing or providing certain kinds of treatments, concerned about how it could affect the health of the woman and, again, the health of the fetus. And the same thing's true for OBs, that they're not necessarily spending as much time looking at the dental health care of the women when they're coming in because, again, of lack of knowledge and training. So with knowledge of both, it helps, the training on both sides helps when women are coming in to look at the oral health needs to make sure that those are being addressed as well. This helps, again, for more successful healthy births, but then also for health for the woman itself. The program is the first of its kind in the country. It's the first time that a dental school and OB residents have come together to do this. And so our hope is that based upon the success of this program and how we see this work, this will then be replicated in other medical schools around the country and dental schools. So again, in addition to these grants, we've made throughout, in other areas throughout the region. So just to give you some sense of that, we've made grants to Haven and Pontiac for their clinic programs up there, for health clinics in Western Wayne, a program at Beaumont Hospital, and some healthy food programs and prevention programs with community development organizations. So again, looking at the areas of both population health and treatment programs are something that we're interested in as we're going forward. There's going to be another area of funding in medical research, separate from the community benefit. And tomorrow, we'll actually be sending out an email to most of you, but more specifically to the medical research community about the availability of funds in this area. So very quickly, we will consider research projects that augment or extend currently funded research, so not new research. The projects must have been awarded research grants that have come through a vetted competitive process from recognized research programs such as the National Institute of Health or similar government research entities, or private ones such as Multiple Sclerosis Society, Muscular Dystrophy Association, American Cancer Society, the American Heart Association. Point being that they're going to be vetted research projects and not necessarily from specific foundations that have a particular interest in a particular area and are making grants directly, but are not necessarily vetting the research that's coming to them. Our grants generally will be on a one-time basis. The grant range will be $50,000 to $100,000 in the research work in cancer and in heart and circulatory systems and neurology. And we do have smaller grants available in other areas, and we will be targeting those and sending out information about that as we're gathering that information and making those grant dollars available. I'll talk a little bit about our application process coming up, but for the research projects, there's going to be 2 application deadlines per year as opposed to the 4, similar to what Serby was talking about, and you'll see that in the notification. They'll be coming up May 15th this year to be considered at a November meeting, and the applications for the May meetings will be due in the December of the preceding year, so it gives us about 6 months to do the review process of those. And so our application, the DMC Foundation has not gone online yet, where our plan is to have a similar application process that the Community Foundation has, and that'll probably be online in the next 6 months or so. So at the moment, you go to apply, you look at the dmcfound.org, where you will find our application guidelines. We again have quarterly meetings. The next one is coming in May of this year. Just as Serby said, same idea. You can submit application to us anytime, but by meeting those deadlines, we will then be able to get you to the next quarterly meeting, which is again May, August, November, and February, March of each year. There's a copy of, I think, the guidelines in your packet, but there'll be a new set of guidelines that's going to be posted today, tomorrow. The only thing that's really going to change on that is the medical research part of it. So most of everything that you see in the packet is going to stay the same, but if you're interested in medical research, do go online and you'll see the very specific questions that are in that particular area. Again, as Serby and Katie said, review the guidelines really carefully. And if you have a potential project or you're interested in a project or you're thinking about something, then give us a call. Same thing, talk to us first. We want to make sure that you have something that is connected to what the DMC Foundation is interested in, that we can talk about that, understand what the aspects of it are, good time to apply, and whether it's something that's going to be in our area of interest. The proposal is that it should give a really full and complete explanation of your project and what difference it's going to make to the target population that you're planning on serving. And show us your experience and your ability to provide the program. You may be moving into some new area or to a different target population than you have treated or served historically. That's great, but again, your experience up to that date then really strengthens our looking at that application and seeing that you have the capability and capacity for providing that program. Budget, again, should be proportional to your overall agency budget, and also the budget itself for the project should make sense to what it is you're trying to accomplish. We will fund fully project areas. We're not looking to have it necessarily be funding that has to be matched by other sources. That's always great, collaborating and bringing other funding sources. But especially if you're starting a new program or moving in a new direction, and these funds will make the difference to get that started, we certainly will take a good look at that. The sustainability issue, we know it's always a challenge for you. It's always a challenge for nonprofits about how do you continue this program past the funding that you may get from the DMC Foundation or other sources. But that plan is really important to see how you hope that this will get integrated into your services going forward. So it's not just a program that gets started and then unfortunately because the funding ends, you're no longer able to provide it. Our projects are generally 1 year long. We will do multi-year projects, 2 and 3 year projects. But again, the grant range for us is in the $10,000 to $100,000. We will do multi-year projects, but the range would still stay about the same. So if you, maybe a $100,000 project spread out over 2 years or even 3 years is very possible. And again, discussions that we can have with you about what makes sense in terms of doing that. Probably a question you might ask, and it's a good question, so I'll ask it for you, is, so does the Community Foundation staff and the DMC staff consult with each other about applications that come in the door? As much as I don't really like talking to Katie and Serby, we're sort of forced into it at times. That is one of the advantages of being at the Community Foundation, the DMC Foundation, is that we do consult with each other. There is no harm in applying to both the Community Foundation and to the DMC Foundation for the same project. But again, it's the same thing. Talk to us first. And I would also encourage you, if you happen to talk to Serby or have to talk to Katie, and you've already talked to me, just let them know that, and vice versa. It makes it easier for us to know, okay, so you already had this discussion with the folks from the Community Foundation. Again, we're going to discuss it, and if we feel that there's a stronger fit with a program at the Community Foundation or the DMC Foundation, and we think that that's the best source for support for the program, then we'll talk about that, and we'll also talk to you about it. We're not going to do this behind closed doors and then surprise you at the end that you didn't know that we were having these discussions and there's either a denial from one or the other based upon the discussions that we had. We didn't have a chance to discuss you with it. But it's important to know, yeah, we are talking about these things, but our purpose of these discussions is to find the strongest fit for your program and where we feel that there are the funding that will really make the difference coming from the variety of funds that we're looking at. So finally, I want to, and on my note, turn it over to Randy. We'll talk about the important work we do with both building endowments and such as that reminds you and remind ourselves that we depend on you. Your projects and your talent and your connections to the community are what make the foundation successful. These funds are terrific, but without the work that you do, those funds just sit at the Community Foundation waiting to do something in the community. I know, and my colleagues do too, all having been in your chairs at one time or another, that the application process is really hard work. You have a lot to do. For your smaller organizations, you're running programs and filling out applications and setting up tables and serving clients and such like that. And even for larger organizations, there's lots of work to be done in terms of fundraising and such like that. So that's why we encourage these calls, because we want to make sure that your time is being used to its best advantage, and that advantage being to serve the communities that you're doing. We think together we can really put together some quality programs to improve the health of our communities. So again, I want to end my notes by thanking you all very much for all the hard work that you do, and the reason why the success that the Community Foundation has and the DMC Foundation has is because of the successful work that you're doing in our programs. So thanks very much.